Hello, welcome. If you are new in this channel, my name is Dr. Longa, DNP, Family NP certified, Psychiatric Mental Health NP, board certified. Today we're going to talk about sleep apnea. Sleep is extremely important for our health and well-being. Unfortunately, a lot of people worldwide suffer from sleep disruption. About 1 billion people worldwide suffer from this problem. 1 billion with a B. In the United States alone, about 80 million people suffer from sleep apnea. In this video, we will explore what sleep apnea is, its causes, symptoms, available treatments, and possible complications if left untreated. What is sleep apnea? Sleep apnea is a sleep disorder characterized by repeated interruptions in breathing during the night. This is when people stop breathing completely for a few seconds or even a few minutes. The types of sleep apnea are obstructive sleep apnea, abbreviated as OSA, is the most common form and is simply caused by blockage of the airway, usually when the soft tissue at the back of the throat collapses during the sleep, and when they collapse, they block the airway. The second type is central sleep apnea. This one occurs when the brain fails to send proper signals to the muscles that control breathing. The third type is known as treatment emergent central sleep apnea, and it's basically a combination of the two. The most common symptoms of sleep apnea include loud snoring, episodes of breathing cessation during sleep, abrupt awakenings accompanied by shortness of breath, gasping for air, excessive daytime sleepiness or lack of energy. Disturbed sleep in general, morning headaches, people wake up with a terrible headache, people wake up with dry mouth and or sore throat, irritability, mood changes and depression, loss of libido, and insomnia. Factors that cause sleep apnea. The number one is excessive weight. People who are overweight are about 50% of all people who have sleep apnea. The neck circumference, the bigger the neck, the narrower the airway. And then also genetic factors. People from families that have sleep apnea also tend to inherit that. Being a man, men are 2 to 3 times more likely to have sleep apnea than women. Age. Older age is a factor for developing sleep apnea. More older people have sleep apnea compared to younger people. Also, the use of alcohol, sedatives, or tranquilizers. These substances relax the muscles in your throat, which can worsen obstructive sleep apnea. Smoking is another factor. People who smoke are 3 times more likely to have sleep apnea. Smoking increases the amount of inflammation and fluid retention in the upper airway. Nasal congestion due to allergies or other factors tend to have sleep apnea. Other medical conditions like congested heart failure contribute to sleep apnea. Treatment for sleep apnea. CPAP machine is often considered the most effective treatment for obstructive sleep apnea. CPAP stands for continuous air pressure. This pressure keeps the airway open. And it takes some time for people to get used to a CPAP, but eventually they get used to it and they get a very good sleep that is very restful. Other oral appliances that can be used to open the throat while sleeping. Surgery is also another option. They do surgical procedures to remove some of the tissues around the airway. And then lastly, lifestyle changes like exercise, avoiding alcohol and smoking altogether can help with the treatment of sleep apnea. Complications of sleep apnea. If sleep apnea is not treated, it can result in type 2 diabetes, high blood pressure, heart failure, kidney disease, even stroke. as well as non-alcoholic fatty liver disease, and finally, it can result in sexual dysfunction. In conclusion, thank you for watching. Sleep well, take care of your health so that you can live a long, healthy life. Please like this video, share, and subscribe. Thank you very much in advance, and God bless. Bye-bye.